Hi everyone, and welcome back to The Journey. As you can see, today we're going to be talking about gastrointestinal system, but more in particular, gastritis. So I'm going to go ahead and give a little background information just so you guys can get a better understanding of how the GI tract works. Okay, so here's my illustration. This is the GI tract. So I kind of color coordinated things so you guys can see what organs are, where they are. So I have the esophagus, okay, which pretty much I have in purple. The liver I have in orange. Gallbladder is green. I have the duodenum, which is part of the small intestine. That's in blue. All right, and then in brown here I have the large intestines, and then I have the stomach, which is in yellow. And then I have a special characteristic here that I put, which is the esophageal sphincter, which is right at the top. So we all know we eat food to get energy for our bodies to get fuel and do every day-to-day living things. Okay, so I eat the food. It goes down into the esophagus, right? That is the tunnel passageway for the food to go into the stomach, right? This sphincter opens and closes. This esophageal sphincter opens and closes. As the food goes down, it opens, right? And then it closes itself because you don't want the gastric content from the stomach to end up getting into the esophagus. Because when that happens, the acidic level is so high, it eventually erodes the lining or damages the esophagus. And I have a video out called GERD. So if you're interested in knowing more information about gastric reflux disease, definitely check that video out. So now the food is in the stomach. The stomach then breaks down the food using the hydrochloric acid, right? The food then travels from there to another sphincter called the pyloric sphincter, all right? That opens up into the duodenum, which is the first part of the small intestine. The small intestine has 3 different things. I won't get too deep into it, just the first one, just because that's the one that you're going to see most information about, okay? Just because it handles a lot of stuff, okay? So in the small intestines now, the body does secrete secretions that helps to neutralize that acidic levels that's inside of the gastric content. So sodium bicarb or bicarb is being secreted out into this area to neutralize it. If the food further gets broken down in the small intestines till it travels and travels and travels, and as it travels, they have these little things on the small intestine called villi, and what the villi are doing is absorbing all of the nutrients that the body needs. And it's absorbing. By the time it gets over to the last part of the small intestine, eventually it connects to the large intestines, and the large intestines has 4 main parts. You have the ascending colon, transverse colon, the descending, and then the sigmoid colon. Okay, so the stool is traveling and traveling. As it's traveling, the large intestinal responsibility is to pull, and reabsorb all of that water back. So it's absorbing the water as it's traveling. More and more water is being absorbed. So that way the stool starts to get harder and harder and harder, which is the waste product, right? So it gets harder and harder and harder. And with it getting harder and harder, right, eventually it gets to a solid consistency or so. And within the large intestines, the stool is being formed, and eventually it is secreted. It passes the rectum, and finally out the anus into the toilet of what we know to be when we say we have to go to the bathroom. All right. So this is just a quick summary of what's going on in the GI tract, so you guys can understand exactly the different diseases that are going to occur and in what areas it's affecting. Okay. So just over here, just some things to watch out for. So the stomach pH level is 1 to 4. And you may say, why is that important? It is important because sometimes they do like to ask test questions about certain regions of the body that the pH level is 1 or 4. What area of the body is that a part of? They may not say it particularly in that way, but they do want to make sure that you know, so that way you know what kind of diseases are occurring, like peptic ulcers and things like that. If you see a pH level of this, where is that peptic ulcer occurring? Is it in the gastric area? Is it in the duodenal area? Is it in the esophageal area? Things like that. All right, it has 4 different layers: the stomach, the small intestine, the large intestines, and the esophagus. They all have those four layers. okay? And the main layer that you need to pay more attention to is just the mucosa area, okay? And I'll let you know why in a sec. So the mucosa area is the main layer that you want to pay attention to. And again, like I said, the stomach secretes digestive fluid, which is your hydrochloric acid, to help break down food. That's one of them, okay? Then you have your small intestines. And your small intestine is the longest segment in the GI tract, right? And I know here you're probably saying it doesn't look like it, but it coils, it coils, it coils, it coils, it coils. It probably represents 2/3 of the GI tract, okay? So you can think of it like, I guess, my hair. You see how it's I pull it, and the minute I let it go, it just boings right back up, right? Or it coils up. Think of that as your small intestines, okay? So it is wrapped around and it is tightly coiled within the body, all right? It is responsible for absorbing nutrients, like I told you, and the pH level for the small intestine is higher than 6. So anything that you see that's higher than 6, that is your small intestines. And then finally, your large intestines, it's your elimination of your waste product, right, which is your stool or poop or however you want to call it, but then it's going to reabsorb the water, okay? It's reabsorbing back that water, and then it also makes vitamin B and K, all right? So now I'm going to go on with gastritis and let you know exactly how does this play a part in what region. So now we have gastritis, right? And anything with itis is going to be inflammation. So gastric, we know that's the stomach, so inflammation of the stomach, all right? Where in particular? Inflammation of the gastric or stomach lining, okay? So that first layer, that mucosa layer that I was talking about, that is the layer that is having the inflammation, okay? You can either have acute or chronic. Acute is rapidly or happening suddenly, and it can be up to 6 months. So anything that happens in a time frame from 0 to 6 months, that is your acute phase, okay? And then a chronic is longer than 6 months. And chronic can be years and years and years, but anything longer than 6 months is now considered chronic. All right. So here we have acute gastritis, and the causes of acute gastritis can be dietary consumption or / medication. So we have contaminated foods, which you have your disease-causing microorganism, right, which is your food poisoning, right? Then you have your highly seasoned food, your spicy food, your acidic food. Any type of those type of foods can cause acute gastritis, okay? The overuse of aspirin or other non-steroidal anti-inflammatory drugs, also known as NSAIDs. So if you see the word NSAIDs, that's exactly what it is, okay? And you also have an excessive amount of alcohol intake, bile reflux, and radiation therapy. Okay, and with bile reflux, you may say, what is bile? Okay, as you can see when I did the illustration before, I showed you where you had the gallbladder. And within the gallbladder is responsible for making bile. It rests inside the liver, well, not inside, but a part of the liver, right? It sits right on it. And what it does is responsible for secreting bile. And bile is used to break down the fatty foods that we eat. So it is secreted. And sometimes when you have, when it's secreted, you can have a reflux of that, and the exposure of the bile can cause erosion of that layer, okay? And with that, you have the inflammation, okay? So that's where the bile reflux comes in that can cause the acute gastritis. Next is chronic gastritis. So with chronic gastritis, right, the causes is a prolonged period of the gastric inflammation, which we know to be up to more than 6 months. So it's just a prolonging of the inflammation, and that can be because either it's an autoimmune disease or something that genetically or hereditary that you inherited, right? Dietary factors, which of course is everything else that I've said with the food, a constant eating, a prolonged eating of the spicy food, acidic foods, highly seasoned foods. And also caffeine and alcohol use, okay? So a prolonged use of those things can also mess with the stomach over time. You have benign or malignant ulcers. You have Helicobacter pylori, which is also known as H. pylori, and once in the body, it never leaves, okay? So it can always go into its submission phases where it's not actively causing any harm, but it never leaves, okay? Medications, okay, prolonged use of medication like we talked about, like you have the aspirin or the NSAIDs, and NSAIDs are pretty much Advil, ibuprofen, which Advil is the brand name of the ibuprofen. Those type of medications is going to be your NSAIDs, okay? Anti-inflammatory properties is what they're going to carry. All right. Then the next thing that you have is your smoking and your reflux. All right. So again, smoking definitely over a period of time changes different parts in the body, especially your vessels. It can makes your vessel constrict, and it irritates the stomach lining. Okay. So these are your things that you can see that why a person will have chronic gastritis. Next is clinical manifestations of the acute gastritis, which is pretty much your signs and symptoms, which is your nursing assessment. Okay, so I'm actually going to go ahead and put that in a different color, is acute gastritis. All right, signs and symptoms. So you're going to have a rapid onset of the symptoms, right? Explosive diarrhea, abdominal pain / reflux, headache, and then you have nausea, vomiting, and anorexia. And it's not the anorexia that you think where you're starving yourself and to make yourself skinny, right? But when they say anorexia, when they use the term anorexia, when they're talking about a sign of symptoms or clinical manifestation, they're talking about the fact of poor appetite. So this patient will have a poor appetite when it comes to these things. Now, I kind of put these at the bottom here. Okay, so I guess you can kind of split it like that. These things here is what you're going to see specifically for acute gastritis. These things here are more common where you're going to see with acute gastritis and chronic gastritis. So I always like to remember the things that are different rather than the things that were the same, because when you get tested, they're not going to put the things that are similar. They're going to put the things that makes them different. So I always like to study this part first. Then once I get the understanding of this, then I go ahead and study the things that they have in common. All right? But again, it's just a helpful tip. You can study it the way how you would like to study, but I always like to study the things that are different, so that way when I can compare, I know the difference between the two. Right. So, clinical manifestations of the chronic gastritis, right, which is your signs and symptoms and your nursing assessment. So, heartburn after eating, all right? Belching is you're going to have more structural damage. You're going to have a sour taste in your mouth, okay? And malabsorption of vitamin B12, all right? Now here, like I did before, I'm just going to go ahead and draw a line, right? Because if you notice, these three things were the same three things that we saw for acute gastritis, okay? So they both share anorexia, which is the poor appetite, nausea, and vomiting, okay? So those are the symptoms that they share. So what makes them different is these things up here, okay? And then one of the complications, the main complication that you want to try to prevent is PUD, P-U-D, which is also known as peptic ulcer disease, okay? And I'll go ahead and do another lecture on that, and that will explain more of what peptic ulcer is all about and how this can lead to peptic ulcer. Now we have medical management of acute gastritis, which gastric mucosa is capable of resolving itself within the first episode or that one episode, and your appetite may be affected for at least 2 to 3 days. All right, so for the most part, it's able to fix itself. But again, if you continue to, provide those factors that are irritating the mucosa, then that's where it leads to it lasting longer than that one episode, that 2 episodes, then eventually becoming chronic, and then from chronic going into a complication known as peptic ulcer disease. Okay. Next thing that we have is medical management of chronic gastritis, and with chronic gastritis, right, you want to change the modifying factors that are going to cause the problem. So like I said before, that's your foods and your medication. So if you're the type of person that like to take aspirin all the time, or Advil or ibuprofen constantly because I'm in pain for this or I'm in pain for that, or whatever the case may be, that puts you at a higher risk. So there may be certain medication that you may want to alternate, right? Tylenol, right? Tylenol kind of works the same to get that pain relief. So you may want to use Tylenol one time, use the ibuprofen the next time, Tylenol the next time, and then so forth, back and forth, okay, instead of just only taking that one category. All right, and then foods as well, like I said before, switch up those dietary foods that are going to irritate the gastric lining. So now we have nursing interventions, and with our nursing interventions, we are mainly trying to decrease anxiety from the patient, right? Avoidance of the irritating foods, whether they are spicy, acidic, greasy, caffeine, alcohol, nicotine, or highly seasoned food. Anything of those combination is going to irritate the stomach lining. So you want them to avoid those foods, or at least in moderation, okay? Because some people, they're still gonna like their spicy food, they're still gonna want their foods highly seasoned, whatever the case may be, but you still want to let them know, hey, at least if you're not going to avoid, at least let's cut this down into some type of moderation. All right. Next thing you want to do is make sure that you have adequate nutrition for the patient while they're vomiting and they have the upset stomach and they're not able to keep anything down. You don't want to give them anything, so you want to continue to keep that NPO status. Okay. I know sometimes some people, they like to tell them to drink Gatorade or things like that. When you have an upset stomach and you're vomiting a lot, you don't want to have anything but water, because you don't want anything else to irritate that. But while they're in the hospital setting, they will probably be on an NPO status, which is nothing by mouth, right? Unless the doctor orders a diet. And the diet could be clear liquids for a while, just so you can get the stomach to rest, the GI tract to rest, okay? Or you may say, oh, but they're going to be dehydrated, right? Because they're losing all of this fluid because they're vomiting, right? That's one of the main things with vomiting that we have to watch out for, is for dehydration. Well, in the hospital, they have an IV, so they will be getting IV fluids, okay? So while they're not eating, they are still getting fluids just because it's going through the IV. So it gives the GI tract a time to rest while they're still getting fluids, okay? But if you're at home, you may want to just drink water. Just drink water just to stay hydrated, okay? And then once the vomiting and the episodes have stopped, then you can go ahead and drink a Gatorade for your electrolytes to put those things back in, and then begin to eat a bland diet and then work your way up. So that way your stomach is not just right then and there back to spicy food, or these foods that's irritating the stomach lining, okay? So you want to have adequate fluid balance, which I just spoke about. Pain relief, right? Because they're going to be in abdominal pain and things like that. So you want to make sure that their pain is controlled, that it's managed. All right. Also monitor the amount of medication that is going to disturb the GI lining, right? Or they may have to avoid it altogether. So for some people, they may tell you, oh, I can't take aspirin, or I can't take Advil, or any of those NSAIDs medication. I just can't take them, right? So with that said, you want to make sure that they're avoiding those medications, or if they just so have to have those medications, that they're monitoring them out, that they're not taking too much of it, okay? Also, they may be on antibiotics, especially if the reason was because of food poisoning or so, right? They may be on antibiotics, or antacids. And antacids is pretty much your neutralizer medication. So these are your Tums, right? Those Tums commercial that you see. And what they do is they kind of neutralize the pH level. So like I said before, when I had it up here, the pH level is 1 to 4, right? And with that, the irritation, the acid is not going to make it any better. So you may want to neutralize it with an alkaline type of substance that is going to increase the pH level, okay? So that way it gives the stomach more of a soothing effect, all right? And if the patient have problems with digesting or absorbing vitamin B12, right? They have vitamin B12 deficiency, which is known as pernicious anemia, all right? That's what that term is called. Then you want to educate them about their vitamin B12 injections, okay? And you want to let them know that it's a lifelong injection, and it is an injection, not PO, right? It is an injection, because if it goes into the mouth, it is completely destroyed once it goes into the stomach, okay? And it's pretty much as if you never even had the medication. So those medications only given through injection, okay? So you want to educate them about that, and it's a lifelong thing because your body needs vitamin B12. And this person, they cannot absorb it. They don't have the factors to absorb it. So it can sit in the stomach and it won't do anything because you don't have the factors to dissolve the vitamin B12. Because if that was the case, the food that has vitamin B12, you'll be able to absorb it. But you're not able to absorb it, so it's just going to just be destroyed and just go out your body. So you want to make sure that you're injecting it. So that way it goes into the bloodstream and provides the nutrients that it needs to provide, or the function that it needs to provide to the cells and to the rest of the body. So do not put it in the stomach because you don't have the factors to digest it. So it's just going to be destroyed and go out the body, right? You want to inject. Okay, well that's it for this video. Thank you for watching. Again, please subscribe. Share this video if you like it. Give it a thumbs up. And don't be shy. Please comment in the comment section below. And see you on the next time. All right?